These are unprecedented times is one of the most common phrases heard during the pandemic. And sure, a global pandemic is definitely unprecedented, but some things are still the same. Gender bias in the media still persists. Currently, female leaders make up less than 12% of world leaders. The age-old idea that men are different leaders than women is never more clear than in times of crisis. The COVID-19 pandemic is no exception. Two countries with starkly different approaches to the pandemic clearly show the difference in leadership between men and women. In examining New Zealand's response to COVID and the media's coverage of Prime Minister Jacinda Ardern's handling of COVID compared to the United States' response and the media's coverage of former President Donald Trump's handling of COVID, the media's gender bias against female leaders is clear. New Zealand is a constitutional monarchy with a parliamentary system of government. New Zealand has a single chamber of parliament called the House of Representatives. New Zealand has elections every 3 years to determine members of parliament and the Prime Minister. They use a mixed member proportional voting system, meaning the party with the most votes usually needs to form a coalition with another party to have the confidence of the House. Voters get 2 votes, one for their local member of parliament and one for their preferred party. Therefore, the House is made up of electorate and list seats. They are a responsible government system that requires ministers in the cabinet to first be elected members of the House of Representatives to serve. The Prime Minister is the leader of the party in power. The Prime Minister appoints cabinet members and sets the cabinet's agenda. Jenny Shipley was elected the first female Prime Minister of New Zealand in 1997. She served for 2 years and was succeeded by New Zealand's second female Prime Minister, Helen Clark. Clark served from 1999 to 2008 and currently holds the title of New Zealand's 5th longest-serving Prime Minister. While New Zealand has already had 3 female Prime Ministers, the United States just elected its first ever female Vice President. The United States has been a country for over 244 years, but has yet to see its first female president. The closest the U.S. came to electing a female president was in the 2016 election, when Hillary Clinton became the first female presidential nominee for a major political party. That 2016 election was the start of Donald Trump's political career. With no prior political experience, Trump entered the presidential race on June 16, 2015. After winning the Electoral College, but losing the popular vote by almost 3 million votes, Trump took office on January 20, 2017. That same year, on October 26, Jacinda Ardern became New Zealand's 3rd female prime minister. When she was 17, she joined the Labour Party. After graduating from college, Ardern became a researcher for Labour Member of Parliament Phil Goff, which led to a position on the staff of Prime Minister Helen Clark. In 2008, at the age of 28, Ardern became the youngest member of Parliament as a list candidate for the Labour Party. Throughout her time in Parliament, Ardern rose to prominence. In 2017, Ardern became the elected Labour Party's leader. This eventually led to Ardern becoming the 40th Prime Minister of New Zealand. Before taking office, neither Trump nor Ardern would have anticipated the challenge of COVID-19. The first case of COVID-19 in the U.S. was identified on January 20th, 2020. A month later, on February 26, 2020, the first case of COVID-19 was reported in New Zealand. In New Zealand, Jacinda Ardern and her cabinet had disease models that indicated the pandemic would spread widely, overwhelm their healthcare system, and disproportionately affect Indigenous Maori and Pacific peoples. In February, New Zealand started preparing their hospitals and implemented border control policies. After the first COVID case was identified in New Zealand, information came out that COVID was more like severe acute respiratory syndrome than like influenza, which indicated that containing COVID was possible for New Zealand. By mid-March, community transmission was occurring in New Zealand, and the country did not have sufficient testing or contact tracing to contain the virus. Based on this information and the support of scientists, Ardern switched from a mitigation strategy to an elimination strategy, and on March 26, the government implemented a countrywide lockdown.
This is not a decision taken lightly, but it is our best chance to slow the virus and to save lives.
The first COVID death in the U.S. occurred on February 6th. Instead of preparing for the potential impacts of COVID, Trump and his White House were focused on trying to downplay the virus. The administration only took minor steps such as setting up a COVID task force led by Vice President Mike Pence. Trump, along with Fox News, spent most of February portraying COVID as under control and a Democratic hoax.
And this is their new hoax.
The lack of preparation and developing testing led to test shortages and the undetected spread of COVID throughout the U.S. In March, COVID started to impact daily life in the U.S. On March 11th, Trump announced a European travel ban and economic relief. On March 13th, Trump declared COVID a national emergency. By the end of March, more than 30 states had implemented stay-at-home orders due to the opinions of most experts, which severely disrupted the U.S. economy. With Trump tying his re-election to the economy, he continued addressing COVID with unwarranted optimism and recommended harmful treatments such as hydroxychloroquine against the FDA's warning. In late March, Trump closed the U.S.-Canada border and the U.S.-Mexico border as the U.S. reached 100 COVID deaths. On March 26, the Senate passed the Coronavirus Aid, Relief, and Economic Security Act, providing $2 trillion in aid to hospitals, small businesses, and state and local governments. As the toll of the pandemic was mounting in April, Trump's early praise of China's COVID response turned to blame. Trump blamed China and the World Health Organization for the U.S.'s poor COVID response. Trump also targeted Democratic governors who maintained lockdown orders because of the negative effects their lockdowns had on the economy. After the CDC announced guidelines for people to wear masks, Trump said he was not going to wear a mask.
This is voluntary. I don't think I'm going to be doing it.
This set off the anti-mask movement in the U.S. and contributed to the long-term spread of COVID. The U.S. reached 10,000 COVID deaths on April 6th. On April 23rd, Trump suggested bleach as a potential COVID treatment, and the next day, the U.S. hit 50,000 COVID deaths. By the end of April, the U.S. reached 1 million confirmed COVID cases, and Trump allowed federal stay-at-home guidelines to expire. By April 30th, the cases in New Zealand were declining rapidly, and the lockdown was moved to Alert Level 3 for the next 2 weeks. In April, Ardern announced that New Zealand government leaders, including herself, would take a 20% pay cut for 6 months in solidarity with those struggling financially through the pandemic. In the beginning of May, New Zealand's last COVID case was identified and isolated. This marked the end of community spread in New Zealand. On June 8th, the government moved to Alert Level 1, marking the return to normal life in New Zealand. In May, Trump shifted to denying that there was an issue with the U.S.'s COVID response. Though the U.S. led the world in COVID cases and deaths, Trump tried to say his early actions in January to limit travel from China had saved the U.S. from having a death toll in the millions, despite the fact that most COVID cases in the U.S. originated from Europe. States began to reopen non-essential businesses against experts warning that premature reopening would lead to a second wave. Trump shifted focus again from the virus to his re-election campaign and planned to resume his rallies. On May 27th, the U.S. reached 100,000 COVID deaths. With a lack of concern and leadership from Trump, the pandemic continued to grow in June. By June 30th, the U.S. had over 126,000 COVID deaths and over 2.5 million confirmed cases. In July, the pandemic showed no signs of slowing, and Trump's response was to withdraw from the World Health Organization on July 7th. In New Zealand, there was an unexpected outbreak of cases in August. Auckland was put on Alert Level 3, meaning the city was essentially put on lockdown. Ardern received excessive criticism from Trump for the outbreak. Ardern responded to Trump's inaccurate and unwarranted criticism.
In fact, even New Zealand, you see what's going on in New Zealand. They beat it. It was like front page, they beat it because they wanted to show me something. The problem is big surge in New Zealand. So, it's terrible. We don't want that.
Obviously, I don't think there's any comparison between New Zealand's current cluster and the tens of thousands of cases that are being seen daily in the United States. Obviously, every country is experiencing its own fight with COVID-19. It is a tricky virus, but not one where I would compare New Zealand's current status to the United States. I'm not concerned about people misinterpreting our status.
By the end of August, the U.S. had passed 6 million cases. In September, the U.S. surpassed 200,000 COVID deaths and 7 million COVID cases. On October 2nd, Trump's terrible COVID response caught up to him. He and his wife tested positive for COVID. By the end of the month, the U.S. passed 9 million COVID cases. 2020 was also an election year for New Zealand. On October 17th, Jacinda Ardern won re-election in a landslide due to her successful management of COVID. Ardern's party, the Labour Party, won 49% of the vote, which was the best showing for the party in 50 years, and was the most votes a party had won in New Zealand since 1996, when the country switched to a proportional representation system. This gave Ardern's party the ability to govern without coalition building. In October, the restrictions on Auckland were lifted. The August outbreak was completely under control. On November 7th, Trump lost re-election. As cases and deaths continued to rise, Trump continued his complacency and shifted his focus once more from his failed re-election to proving voter fraud. In November, the U.S. reached 13 million COVID cases and over 250,000 COVID deaths. In December, the FDA approved the Pfizer and Moderna COVID vaccines. The death toll surpassed 300,000 and the U.S. COVID cases passed 19 million. In the last days of Trump's presidency, he made history not just for the uncontrolled spread of COVID. Trump was impeached for a second time on January 13th for inciting the insurrection on January 6th at the Capitol to stop the certification of Electoral College votes for Joe Biden. The day before Trump left office, on January 19th, the U.S. passed 24 million COVID cases and 400,000 COVID deaths. On January 24th in New Zealand, a COVID case was identified in a resident who contracted the South African strain during managed isolation in a hotel. Due to the government's contact tracing and testing procedures, New Zealand was able to contain the case and did not need to implement COVID restrictions. New Zealand looked to approve the Pfizer COVID vaccine in early February. As of January 31st, 2021, New Zealand has had a total of 2,307 COVID cases and 25 deaths. This overview of COVID in New Zealand and the US from February 2020 to January 2021 demonstrates distinct differences in leadership between Ardern and Trump.
We withdrew from the Human Rights Council, and we will not return until real reform is enacted.
If I could distill it down into one concept that we are pursuing in New Zealand, it is simple, and it is this: kindness.
At the center of Trump's leadership style was his concern for how well the U.S. economy was performing. Trump prioritized the economy over human lives and refused to listen to scientists. Ardern took the exact opposite approach. Her number one concern throughout the pandemic has been protecting and saving the lives of New Zealanders. Though concerns about New Zealand's economy arose, Ardern has put the well-being of New Zealanders first. Ardern listened to scientists from the beginning. She followed their recommendations. Trump left office with over 400,000 COVID deaths. Ardern has had 25 COVID deaths. Per capita, 7% of the U.S. population has had COVID under Trump, while less than 0.05% of New Zealand's population has had COVID under Ardern. Despite the fact that Ardern's response to the pandemic was exponentially better than Trump's, and she approached the pandemic with a real plan, Ardern's response lacked media coverage outside of New Zealand. A significant part of gender bias in media coverage on TV for female politicians is a lack of coverage. There was a lack of TV coverage of New Zealand's approach to COVID under Ardern from global as well as U.S. news sources. In contrast to Ardern, Trump's non-existent response to COVID was widely covered by all kinds of media sources in and outside the U.S. New Zealand is a much smaller country than the U.S., but New Zealand's remarkable success with COVID is no small feat and certainly garners recognition compared to most other countries' handling of COVID. Trump's incessant media coverage helped to worsen the pandemic in the U.S. by spreading his lies and giving a constant spotlight to his anti-mask sentiment. Had the media given less attention to Trump, more people would have understood the real health threat COVID presents. Fewer people would have been anti-maskers, and by extension, more lives could have been saved. Had the media given the same amount of attention to Ardern's effective and successful lockdown, then other countries and states in the U.S. could have seen how efficient it was, and maybe they would have adhered to lockdowns. Had the media coverage been less gender biased throughout the pandemic, arguably more lives could have been saved.